This is Lyon Johnson with the Special Education Service Agency. I'm a project coordinator for the School Mental Health Integration Grant, and I'd just like to talk about our proposal to you for the next 2 years. The School Mental Health Integration Grant, basically how long it lasts, what kind of support is provided by the grant, what does the grant assume, what does the grant help, how it's delivered, and what specific training does it provide. The School Mental Health Integration Grant is awarded by the U.S. Department of Education Safe and Drug-Free Schools. SESA would be the lead agency to provide coaching and technical assistance to build capacity. Assumptions about the School Mental Health Integration Grant. First off, in the more rural areas targeted by the grant, there's very challenging staffing conditions which can impact service. Logistics and weather permitting flying conditions impact services. The other thing is that we do have native tribal values and other community-oriented values that can be harnessed and celebrated as change agents. It could be native tribal values or something important to the community. Also, the assumption is that the school can be used as a change agent to help kids increase pro-social behaviors and decrease problem behaviors. Who's targeted by the grant? First off, regional or community behavioral health provider. That could be for a community or more regional. The school district, student leaders, community and family members. Division of Juvenile Justice, for instance, the JPOs of the community. Also law enforcement and the Village Public Safety Officer Program. Also regional and state agencies or organizations that could help take this to scale in other communities and throughout the state. For example, Division of Behavioral Health, Department of Education, Native associations. How is it delivered? Well, a lot of the training is on-site. We have various trainings which we'll get into in a little bit, but it's a combination typically of on-site and distance delivery of training and coaching and technical assistance. The distance piece could be synchronous, that means real-time, live, but not all in one place, and that is achieved through using Skype Premium, video teleconference. There's a variety of ways that are not even listed here. The other avenue is asynchronous. That means not all at the same time, but through a thread of discussion or collaboration, and that most typically is thought of through email, but we also use Google Apps for education, Google Docs, e-modules, video like YouTube or Vimeo. So a lot of times we do a combined on-site and off-site synchronous. For example, if there's a training in the larger community and the outlying communities cannot make it in, we will try to use synchronous distant delivery to help keep them involved. What are the areas of focus? There's two big ideas here with the School Mental Health Integration Grant. First off, it doesn't necessarily fund direct services, but it's supposed to set up the system that will allow efficient and effective services to happen. That's achieved through two things, building a linkage protocol, we'll get into that, and also skill development of providers in the area and educators and families and everyone that can have a positive impact on healthy development for kids. So what is a linkage protocol? Basically, in its most basic form, it's a systematic communication framework for developing connections among people, programs, services, and organizations. The intended outcome is to improve communication, the referral procedures, and timely delivery of behavioral health services among and between agencies. So what does it look like visually? First off, we want to identify single points of contact at the school, juvenile justice, law enforcement, the community or regional health corporation. We want to have interagency agreements and standard operating procedures and standards of practice. This grant really focuses on positive behavioral interventions and supports at all levels, Tier 1, universal supports, Tier 2, and Tier 3. So if we do this, it'll support decision-making and effective communication and support staff behavior, which in the end can support students and families. So basically, when we develop a linkage protocol, we are making basically a flowchart, and embedded within that flowchart are people, programs, services. So let's take an example of what happened in Bering Strait School District. We identified that the principal is a single point of contact for any behavioral health or behavioral issue, and we typically look at chronic non-emergency concerns versus emergency concerns. And this is written from the school staff point of view. We have one also written from the Regional Health Corporation's point of view, and we have a flow chart from the juvenile justice or law enforcement's point of view. So basically, this maps out how to make referrals for these types of behaviors, persistent problem behavior, but not emergency. But if there are emergency concerns, this part of the flow chart helps us understand how to make referrals and who to contact and what's available and what protocols we should follow. As mentioned, there's one written for the from the Regional Health Corporation's point of view. In this case, it was Norton Sound Health Corporation. They decided, along with behavioral health, that they must follow the rural behavioral health model, given that they're in a remote location. The village-based counselor in this region plays a key role. Communities have different resources and different levels of support. So what we go through in this process is mapping out, developing, and ratifying the linkage protocol, and that's what this is. In this case here, we have what happens when there are chronic or high concerns, the principal to contact the village-based counselor, and so forth. Here's the process. Well, what about if there's an emergency concern with imminent risk? Here's the process for that. The village-based counselor in this case would probably immediately contact the clinician in Nome. Every community is different, given different resources availability and staffing. So here was a process that was identified for this community, this region. So, area of focus. I mentioned that there was another area of focus, and that's skill development for educators, behavioral health providers, law enforcement related folks, and we really we bring the target groups in when it makes sense if there's a training. For instance, we really wanted to bring in all educators when we're talking about positive behavioral interventions and supports at the universal support level. We also wanted to bring in family and leaders. We brought in elders in the Bering Strait region. It could look different in your region, but when we're looking at preventative practices, we bring in the appropriate groups, and for sure it's the educators and any other groups that would like to be involved. The targeted interventions, it would look different in different communities, but certainly educators, and it could be community service providers that are providing services in school. For tertiary interventions, this definitely includes the community or regional health corporation, as well as special education teachers, guidance counselors, anyone who could be involved in implementing a behavior support plan based on a functional behavioral assessment, because that's kind of what we learn in the tertiary interventions. Law enforcement could be included in this. Life space crisis intervention was in the previous grant, special education teachers, administrators. It's very appropriate for law enforcement, community and regional health providers. The new pieces for the upcoming grant, we're going to include mental health first aid, which is a 2-day training, and also applied suicide intervention training. So those will be new pieces of this grant. So what does it look like, the type of training? Well, we have the tiers of support, and this is the public health model. And we have Tier 1 or universal supports. What do we use? School-wide positive behavioral interventions and supports. We have Tier 2 interventions. What do we use as far as practices? We use check, connect, and expect, group social skills instruction, problem-solving groups. So we teach people how to do those effectively, efficiently, and to use data to decide who should be included in those groups. For those kids who don't respond to the more targeted interventions, those who need more intensive interventions, we have functional behavioral assessment and behavior intervention planning training. And then for the really tertiary kind of crisis intervention piece, we have life space crisis intervention, mental health first aid, and applied suicide intervention training. Importantly, if teachers are being trained outside of normal contract hours, we try to take that into account and make accommodations any way we can that is permitted within guidance of the grant. So that will be something that will be discussed. So if there's extra work related to the grant, if there's a way we can provide stipends or extra duty pay as pass-through funds to the school district, we can try that.